Matt Stonham was diagnosed with brain cancer in 2015.
I was losing the use of the right-hand side of my body intermittently, and then I've had a seizure and collapsed.
He's been supported by privately funded nurse care coordinators. There are only 20 of these nurses in Australia who solely focus on helping brain cancer patients navigate a complex treatment path.
They always message and say, hey, don't forget your appointment here or your appointment there.
Brain cancer kills more children than any other disease in Australia and more adults aged under 40 than any other cancer. A study in New South Wales found it cost less to treat brain cancer patients who had the help of a nurse coordinator.
The amount of hospital presentations and the overall length of stay was significantly reduced for people who had a brain care coordinator.
12 cancers have been allocated $32 million in federal funding for specific nurse coordinator programs. Of this, the charity Rare Cancers Australia will receive $4.4 million to include the Brain Cancer Nurse Coordinator program. Brain cancer charities are upset they were not separately funded to run their own program.
It is not appropriate or realistic to assign funding to another organisation that doesn't have the understanding or resources to implement the solution.
The department went through a process to ensure that some of the specialist tumour organisations were still able to provide some of that tumour-specific advice.
Rare Cancers Australia says it remains committed to ensuring everyone with rare cancer gets a dedicated cancer navigator as early as possible. Matt is grateful for his cancer coordinators and is in training for a 150-kilometre charity walk from Sydney to Newcastle to raise money for other survivors.
It's just a good thing to do to show support for these people who have been to hell and back.
Hoping for a brighter future for himself and others, Andy Cunningham, ABC News.